Good afternoon. Mike and Amanda here again. This will be our third opportunity to sit down and visit with you about how we're facing up to the COVID-19 epidemic, what we're doing here in Boone County. You know, there's so much information out there, it gets to be overwhelming. We have federal and state guidelines. What we found seems to work best to deliver the news to you folks here in our community is that if you use the websites that have all this particular information, whether it be the health department, the city of Belvidere, Growth Dimensions, the Chamber of Commerce, we all have a special audience, and we all are doing a real good job of referring to other websites that have other specific information for the community. A couple of things that were of great importance this week: we have yet to have a case announced for our community. It's coming, but it's always nice to know that it hasn't come quite yet, and gives us a little bit of hope in that respect. This week was a big week for the city because, of course, we had the question of whether or not FCA was going to open their doors on Monday. Well, there was a formal announcement made by the company yesterday at 11:45 our time, AM, that they were not going to open the plant. They would reconsider again in 2 weeks. And so that was a wise decision. I feel a lot of phone calls from concerned folks in the community, particularly those that work at FCA. I think they made the right decision. At this time, I think it put too many people at risk at the plant and also regionally, because we got folks coming from 70 miles around that could be bringing, unfortunately, the virus with them. I think it's been a big week, too, for Amanda and the health department in defining what specifically are the most important things for you to do at home, how to keep yourself safe as possible, how to shelter in a positive way. We also have good news that emergency child care licensing has been provided, and so there will be more news upcoming. There was a previous conversation today with Jen Jackie from the Y to talk about that, and it's just another opportunity for us in an informal way to talk to you about what's going on, and we certainly would ask you for your comments or feedback. You can watch us on Channel 20 or go to YouTube and type in City of Belvidere and get these broadcasts at your leisure. Having said that, I'd like to again introduce Amanda Mahl, who is the director of our health department and who has been doing an incredible job to keep us informed, to keep us prepared, to keep us safe. Amanda?
Great. Thank you, Mayor Mike. Again, Amanda Mahl with the Boone County Health Department. Pleasure to be here with you to have another conversation. What are some specific questions maybe that you would like me to address today? I know we kind of want to have just an informal conversation. There's been a lot going on. There's a lot that continues to go on. I would echo the mayor's comments about the locations where you can find credible information. The Boone County Health Department's website, the Illinois Department of Public Health's website, and the Centers for Disease Control's website. Please do not look for credible information on your neighbor's Facebook page, on a blog without links to credible sources. It's extremely important that we try to lower the amount of misinformation that is circulating in our community. We've been fielding a lot of questions and concerns both on social media and on our information line and information email from sources that are not credible and are not providing accurate information. And what the last thing that we want to do here in our local community is cause fear and panic. We want to band together as a community so that we can be stronger as we work to lower the number of cases that we eventually have and hopefully avoid any and all deaths. And if we do unfortunately have deaths in our local area, that we minimize those as much as possible.
Thank you, Amanda. And again, the health department's done a tremendous job about reporting day by day what's going on with the virus as it spreads, et cetera. I thought it might be interesting because overall health is very important to being in as good a health as you possibly can be in case you do become infected. And I thought Amanda might like to speak to things like good nutrition, getting exercise, some examples of how to do that, and other recommendations from the health department, particularly possibly for senior citizens like myself who are at higher risk. So again, here's Amanda.
Okay, great. So I was actually on a CDC webinar earlier today, and they were talking a lot about how, now is a better time than ever to be considering just important lifestyle habits that maybe we're not so good about adopting in the hustle and bustle of our normal day, where now that we're under a shelter-in-place order through Governor Pritzker, that actually this could be an ideal opportunity to focus on family and focus on good lifestyle habits. So some general things that I would recommend on a regular day, but especially right now because hopefully we have some time as a family to do these things, are to drink plenty of water. So a glass of water, which, kind of a normal kitchen-sized glass of about 8 ounces, really every hour is what is recommended. So make sure you're well hydrated, not soda, not Kool-Aid, not juice, but really just water. Let's stay hydrated. Sleep. I know that information overload and feeling nervous and concerned about what's happening, across the country and across the world can make it really hard to sleep. But the more rest we get, the better ready we are to handle just the absolute information overload that's happening right now. And I would also just recommend taking some time for quiet mindfulness. And I don't mean that necessarily in any type of religious sense. If you subscribe to a particular religion, I condone that absolutely. But if you just want to take a few minutes to sit quietly with your eyes closed and take a few deep breaths in through your nose, out through your mouth, that can be really, really helpful. Take a break from social media and from the television, because that can just be absolute information overload. And right now it's very doom and gloom, I think. It's very negative feeling. We just keep hearing about how there are more and more cases and there are more and more deaths and there are more and more people in the hospital and there's not enough personal protective equipment for our first responders and our healthcare workers, and there's not enough ventilators, and that can just cause a lot of anxiety, I think, for our families here in the community. So just taking a break from information overload, I think, is good too.
We have several healthcare entities in the community, of course the health department, but we have Crusader, we have Swedish American, we have clinics for both Mercy and OSF. I thought maybe you'd like to speak to what your special relationship, particularly with Crusader, is and the programs that you have through the health department. And my understanding is that they help with a lot of the seniors here in the community, and I didn't know if you wanted to speak to that. And also, if you had an opportunity as yet, and this is one of the things we're trying to do, reach out from City Hall, is to find out what exactly Mercy's doing and what exactly OSF is doing and what exactly Swedes is doing. And so if you could shed some light on that. I'm trying to set up a conference call next week for kind of an ad hoc steering committee that we're putting together to help backstop you with all of the information and physical requirements that maybe you don't have that we can help with, and what we might look like 2 weeks or a month down the road if this thing accelerated it, in the newer demands that would require and how we can meet those demands.
Okay, that's great. Yep. So right now the United States is in what we call the acceleration phase of this global pandemic, which means that things are climbing, right? So the number of cases are climbing, the number of deaths, unfortunately, are climbing, the number of sort of widespread community issues related to this pandemic continues to grow. So we're climbing. We haven't hit a peak yet, and unfortunately, I wish I could say we're on a downward trend, but we're definitely not there yet, right? And so working really closely with all of our healthcare systems. So we have our Mercy Health, our Swedish American division of UW Health. We have our OSF St. Anthony, which are all based out of Rockford, but do have healthcare facilities here in Boone County and in the Belvidere area. And then also Crusader Community Health that you mentioned, Mr. Mayor. We work very closely with all of those entities. We actually do daily calls with our healthcare providers and first responders where we brief them on the numbers and the information that's available, and we talk through some of the more complex issues that are facing serving the 23,000 plus members of the city of Belvidere and the 54,000 or so residents of Boone County. How do we need to put plans in place to protect the whole community? So we talk about things like if we have, shortages of materials, where can we try to get those materials? We share things. We are working with our school districts to build some sharing of materials and supplies that the school nurses don't need right now that we're actually able to use for our first responders. We're building up plans for how we're going to use our empty school facilities if we need to house people. There's a lot of things that go on behind the scene when you're in the acceleration stage of a pandemic. So it's not just even responding to the crisis, but it's also even trying to plan a few steps ahead. So at the health department, we're doing two things at once, and we're working with the healthcare providers to do this. We're responding, but we're also planning 2 or 3 steps ahead of where we are today. So I'm already thinking with my department, where do we need to be next week and where do we need to be a month from now? I don't have a crystal ball. I wish I could predict how this is going to turn out or when we'll be on the downward trend, but definitely trying to get out ahead of it as much as we possibly can.
Thank you very much. Again, we have a lot of partners in the community, and there will be an ongoing effort. I have to tell you, I've had people from industry reach out to me. Tom Carlton from Defense Technologies has been in correspondence with me a couple times. He sent me another message today saying if there's anything you need, anything that you can see that we can do to help, please contact me. So if other folks are listening here that own a business that is not really working currently in their normal fashion, that have assets, whether they be people or materials or whatever, would be interested in helping as time progresses. We may find roles for other entities to help us in the community. The biggest thing is your support is so important to us, because I tell you, this is very grueling. This is grueling for everybody in government. It's grueling for everybody in healthcare. It's grueling for everybody in social services, for the chamber, for Growth Dimensions. We're trying to reach out to each individual small business. Today, they passed the plan, and I had it printed out. It's 880 pages, 808 pages, this thick. And one of our concerns is, okay, so there are all these provisions. How are we going to figure that out? So we're putting together a plan with some help from the school district and some of their administrators to possibly work through that to research all of those things. So the things that will be available to our community from the federal level and the state level, when they're going to be available, how we apply for them, what's really available in those programs, so that we don't miss an opportunity to get resources that are going to be allotted to us by not knowing when and how and what to do. So I'm really I'm enervated and enthused and energized by how the community's relating to this. We have a lot of people. I notice people out walking, and they're doing social distancing, and they're running and they're walking. I am probably 6 feet from my dog every morning on his leash, but life is not normal. So I think it's important that we try to make our lives, find a new normal for us that's healthy, a new normal that is hopeful, and a new normal that is willing to reach out and help the person next to you. Again, I thank Amanda so much for all that she's done and her leadership in this, because she's the lead dog in this effort. She's leading the pack, and she's done a marvelous job. So I listen to her, and I value her experience and her abilities and her team and how hard they've been working. And so let's make sure that we let them know that whenever we can. A little kind word here and there and a smile are very important. Amanda would kind of like to go over a few things. Again, we will sign off from this segment, and she will do a segment in Spanish. With that, I'll have Amanda make any final comments that she'd like to make in this portion. Here you go.
Okay, great. I would just mention, too, in the spirit of community and positivity amidst this crisis, a lot of people are reaching out to us and they're asking, what can I do? I'm supposed to shelter in place. I'm supposed to stay home. I feel a little bit useless at home, but I'm able-bodied. I'd like to try to assist. So just a couple of ideas that we're pushing out there. One thing that is still safe to do and can be done while practicing, proper protection for an individual and social distancing is to contact our local blood donation centers, and you can call them and they will give you instructions on how you can come in at a certain time when you're separated from other people in a safe way and donate blood. So able-bodied, healthy adults that are able to leave the house to donate blood, call ahead, please. But I know that our blood centers are needing blood donations. That would be one way that you can assist. Another way that you can assist would be to contact our local food pantries. Again, able-bodied adults are encouraged to reach out to facilities and find out when the distribution times are happening. There are drive-through, pull up and put in people's trunk, no physical contact, sort of assembly line operations that are happening locally to get food to our neediest of families who are food insecure, who need to know where their next meal is coming from. And especially with this crisis hitting our economy, we have more and more adults that have been laid off, that are sort of suspended from their jobs, furloughed without pay, and so those demands for needs for food are going to be more and more essential. So we'll make sure that the City of Belvidere has those links to those websites where you can call our local blood centers and our local food banks to participate in those activities. Because those are essential services and they are calling for volunteers at this time, it would be completely acceptable for an individual who's currently practicing shelter in place to make a phone call and find out if it would be appropriate for you to appear in person to do those things. A third thing that I would suggest is just writing a handwritten note to a healthcare facility, to a nurse that you know, to a doctor, to first responder. You can send those to Boone County, you can send those to the City of Belvidere, you can send those to Swedish American, and thank our healthcare workers and our first responders for the immense amount of effort, putting themselves really at risk every day by showing up to work to keep the entire community safe. So those are three tangible ways that you as members of the community can really lend a helping hand in this time of need.
And with that, one last thought for this segment. All of you out there, every person, regardless of your age, you are all, each and every one of you, important to us in this community, and important to Amanda, and important to me, and we will do everything we can to keep us safe and healthy and get through this thing the best of our ability. Thank you.